สวัสดีค่ะ
สวัสดีครับ
Good afternoon, good evening, good morning, and good day to everyone here. Welcome to the first webinar for drug and treatment for COVID-19. My name is Rupesh Chitanwat. I'm the Group Director for Informa Markets in Thailand. Today I'm here with a special guest from the university, Professor Dr. Anusha Abhisa Thanarak. So he will be our guest speaker covering on the drug and treatment of COVID-19, and we have our partners from InnoLab magazine, Ms. Karuna Jintanong.
สวัสดีค่ะ
So today the webinar is focusing on engaging you as the audience to our community for pharmaceutical industry in the world. CPhI Southeast Asia is the exhibition that focuses on pharmaceutical solutions from the ingredients up to the finished dosage form. So the show will be moved to November 4 to 6, which will be in Impact Mt. Thani at Nonthaburi, which is not far from here. We here at the DX Playground Cafe that they allow us to have this webinar during the social distancing period. So today the webinar will be focusing on what we are concerning for today. So I will give this platform to Kun Karuna to lead for the session with the discussion with Dr. Anusha, please.
Thank you, Kuros. Sawadika. So now, today we are quite far because of the social distancing, right? As we know that we are facing on COVID-19, and you know the number of the total confirmed case is about 4 million people around the world, and the global death is 286,000. So the number is still up high, right? And there are a lot of confusing issues, and it is our pleasure to have the expert here, Professor Dr. Anusha Abhisa Thanarak.
สวัสดีครับ
He is the Chief of Infectious Diseases Division Faculty of Medicine, Thammasat University, and you know he is the first Asian doctor who has won the prize from the World SHEA Mid-Career Scholarship Award of 2018, right?
Yes
And okay, go to the first question.
Sure.
So would you please tell us briefly about the characteristic of the COVID-19?
Yes, the characteristic of the cold infection is quite similar to influenza infection. It have non-specific symptoms like fever, runny nose, cough, etc. With a special characteristic of the COVID is that it has a tropism for the lung. So, which means that if you get the COVID, you are more likely to get pneumonia or the lung infection more than influenza in general. But otherwise, the symptoms are fairly the same.
Mm-hmm. So if the patients have the significant symptom of the lung, so they will gain more risk for COVID-19, right?
Yeah, actually, we categorize patients at the risk of severe disease, like people who have diabetes or obesity and a lot of comorbidity. They were more likely to get pneumonia. We categorize it that way more.
So for now, is there any drug or treatment for COVID-19 yet?
Sure. Can you start with the PowerPoint? So I like this figure. This is from the JAMA, and this mentioned about the pharmacologic treatment for coronavirus disease. And the thing I like is that it's illustrating how virus interact with human cell. It starts with virus binding to the receptor, and then it underwent the endocytosis and membrane fusions, and then it underwent the process of encoding of the RNA that underwent the translation to polypeptide and underwent proteolysis to non-structural protein and underwent the RNA-dependent RNA polymerase mechanism inside that turn out to be synthesis of RNA and under the translation into structural protein and assembly, and then the virus has been exocytosis out of the cell. The point that I like about this PowerPoint is also the fact that the medication that we use now, including the chloroquine and hydroxychloroquine, to inhibit the viral entry and endocytosis mechanism, while the HIV protease inhibitor like lopinavir and darunavir inhibit proteolysis process. And the one like remdesivir and favipiravir inhibit viral RDRP is the process that in the play of making the new virus, and this medication has been in use in a lot of medical systems around the world. Additionally, there are some mechanisms that target on the immune system, like IL-6 receptor blocker and IL-6 receptor blocking the signaling as well. And these has been in the play of treat COVID severe infection as well. But so far, I have to say that there's no approved medication has been shown to be really effective, because all the medication so far that has been in the trial has not been shown to be quite effective to reduce the mortality of the patient. So far there's no medication or pharmaceutical treatment that has been endorsed in any guideline in the world.
Mm-hmm. That means there is no antivirus for now for SARS-CoV-2, right?
Can you clarify your question?
So the active pharmaceutical ingredients for anti-SARS-CoV-2, there is no.
Yeah, there's no proof of the medication that's shown to be effective enough to endorse in the medical guideline in any country now today.
Okay. So how we diagnose it?
Yeah, the way you diagnose it is two ways. First, if you want to diagnose acutely ill patients, you have to use the PCR technique, which will diagnose patient from pre-symptomatic period, ranging somewhere from approximately 1 day prior to symptom onset to approximately within 7 to 10 days after they have the onset. That is the standard way of diagnose COVID virus infection. Having said that, there's immunology assay, ELISA, IgM, and IgG that you can detect the patient that has been previously infected to test their immunity, and these can detect the immunity in the range of 14 days or more. So this can help in bridging the gap. But so far, the immunology test has not been endorsed in any guideline for diagnosing acutely ill COVID patients in
So
any guideline.
for acute patients, we have to use RT-PCR, right?
Yes.
And we can use the antibody test or ELISA or anything for monitoring after 14 days, right?
Yeah, if in some cases, if there's some controversy with the result of the PCR, you can kind of use the ELISA as an adjunctive measure to detect the antibody, which the timing of detection is approximately after the 14 days of the onset, because normal human response will produce IgM and IgG after 2 weeks, so it's not serve to detect acute infections, but it serves as an adjunct diagnostic tool.
So how about the sample?
The sample that commonly used now, the one that is very sensitive is nasopharyngeal swab, which has been endorsed in the guideline, which has a very high sensitivity for that.
So we are now in the lockdown policy here in Thailand. Do you agree with this lockdown?
Yeah, I have to say this is not my call. This is the government call. Can you show the next PowerPoint? And this is the PowerPoint that I would like to share that some country, when they lock down, they're doing better than some country. For example, the country that have the doubling time. This is the date around the end of April. And as you can see here, Japan, Singapore, and Hong Kong doing good at that time. And also followed by Korea, China, and as a result, they can easing the lockdown policy. Can you show the next PowerPoint? The next PowerPoint demonstrating that after easing the lockdown policy, some countries like Singapore and Japan has the second wave occur, while some countries can remain the low number of cases like China and Taiwan. So this represents that some country, the country policy has something behind it as well. Another PowerPoint, please, and this is the concept that we use now, is the hammer and the dance. And the hammer means when you lock down, you close the country, you do a lot of policy listed in here that resulting in less cases. And when you have low number of cases, you open some public places, and this is called the dance, and you remain the policy, including the hand hygiene, social distancing, and wearing the mask, and monitoring the case with the aim to keep the R, which means the productive capacity number, lower than 1. R typically represents the capacity that one person can transmit virus to other person. If one person can produce much less than 1, this is a good number. If they are increasing, the policy have to do the hammer again. So this is the concept of hammer and the dance, which I think is applied in many countries around the world.
So if we look at the number of the confirmed case and the death case, some country has 10% death, 5% death, 2% death. What is the reason for explain the number like this?
I think there are a couple reasons. First, the comorbidity can really have some trick because these people who have a lot of comorbidity, like in Western country, people have diabetes, hypertension, and obesity. They were more likely to have the adverse outcome than the country that have less of those comorbidity. Second, maybe due to the strain type of the coronavirus. Some strain will have more virulency than other strain, and also it's really depend on the public health policy. If you do a quick hammer, you can significantly reduce the case that resulting in less people admitted to the hospital. And typically the healthcare resource is very limited during the pandemic. If you have a lot of cases, you don't have enough ventilators, and I think a lot of variety of things are coming to play for your questions.
How about Thailand? The number of confirmed cases is about 3,000. Confirmed case is about 3,000, and the death is only 56. What do you think about this number?
I think it's very good, and I'm very pleased with what the government do with the policy of the hammer and the dance, and also whatever the government do. I think they are doing very appropriate public health policy.
Is there any hope for the vaccine?
Yes, for the vaccine, I would have to say that currently there are more than 80 groups of scientists around the world doing the vaccine trial. But a few points that I would like to share is, the first point is that it will take a while for the vaccine to get to finish that trial, because they have to undergo several phases. And so far, only a few groups that has achieved the phase 3 trial and including the patients into the trial. And I would have to say that it typically would take around more than a year or 18 months, or some vaccine even take more than a decade to get the result done. Secondly, I would like to also share the insight that coronavirus has been previously around the world before, and COVID is the sixth coronavirus that emerged now. And if you look at the history, we still don't have the vaccine for coronavirus. And the example is very clear. We have SARS and we have MERS-CoV, which now we still don't have the vaccine for that. So please be really don't expect too much that the vaccine is going to be quick and the vaccine is going to be effective. So we have to think realistically about what's going on and take into account the history of the coronavirus as well.
Yep. So is there any interesting point for SARS-CoV-2 right now?
I think we are dealing with a lot of unknown with the knowledge, unknown with the treatment, unknown with the vaccine. So really, only things that we left with the weapon is to prevent it, and we have to live our life in a new way. Including we have to apply the mask in the public, we have to apply the hand hygiene, we have to apply the concept of social distancing in the public. And in the hospital, in addition to these three, we have to clean the environment well as well. And also we really have to prepare the personal protective equipment for the healthcare worker, have the workshop for training them to wear appropriately, to doff the personal protective equipment appropriately to prevent transmission among the healthcare workers as well.
It's not easy to wear PPE. Yep.
Yes, I would agree with that.
Yeah. Okay, go back to Kuros. The show will be placed on November.
Yes.
Is there any procedure to protect our visitors and exhibitors?
So what I would say that we are now under the hammer. I want to go and dance already, but still the exhibition business is under the red color. So what I would say now that we are in formal markets, we comply with the Thai government that they will need to have the lockdown and standard procedure. That how we gonna implement the exhibition. So we are proactively that in formal markets, we call the exhibition under the controlled gathering. So we are developing the guidebook that is a standard procedure. But however, we need to comply with the government. Once they let us dance, we are ready with the procedure. For example, we do the gangway, the walkway, we control the visitor density. In a normal exhibition, we always do the pre-registration. So we are enforcing to do more pre-registration. That means we reduce the human touch for receiving the badge. We encouraging on wearing the mask, and of course we considering on the face shield. We do more on the logistics side.
Yep.
However, it is about the compliance that we need to follow the government. We hope that we can dance soon.
Yeah. Is this okay, doctor?
I think it's very appropriate and comply with the government policy as well. And I wish you good luck for your meeting.
Thank you.
Yeah. Last, I would like you to suggest us how to live with COVID-19 happily.
Yeah, that is a very good question, because now I see that people in the community and even the healthcare workers are overwhelmed with the emotion. The emotion that overwhelms them is fear, panic, anxiety. In some way, those type of emotion will make some awareness on protection on themselves. But in another way, it may lead to the negative feeling like discrimination, stigmatization of the patient, which may not do anything good as well. So please be aware that the coronavirus, we have to change our attitude, that we have to live with it, because it is a new virus. It is very similar to the influenza pandemic in the past, that we still don't know a lot of things, but when we know a lot of coronavirus, we probably will be less afraid of it, and we have to change our attitude to live with it with the knowledge, awareness, and consciousness, not by fear and panic or anxiety. And that is the key. You have to listen to the reliable news, not the fake news, not the fake line application messages. You have to use your consciousness to judge the news that you receive as well. So you have to change your attitude about the disease in the future, and our healthcare worker and scientists has to do a lot of things, like the research on the body of the knowledge of disease, on the epidemiology, treatment, and prevention, and that will help understand the disease and live with it happily at the end.
Thank you, doctor. Is there any point of view that you would like to share?
This session is very well explained. I get a lot of visitors that on live, and the back up telling that there is a lot of questions in. But what I would like to explain further why we have this webinar, because we think that this new normal is already a little bit difficult for the exhibition industry.
Yes, that's right.
A little bit difficult for the office workers. We need to stay in the social distancing. We are in the same office, but we could not stay close together. So the idea of having the digital platform or the digital offer to the market is like, there are certain of the country that they are ready to do business, but they could not travel. The airlines stopped and the travel restriction happened. So what we try to do is we upskill our team to be able to handle the platform. In order to do the seminar in big room, we can use the digital platform. And this episode is, I would say, the episode number 1 for the team. So the next episode is interesting. I already get some live question that how can we import into Thailand? Can we do something? So this is a little bit further to my explain that we are going to have this kind of digital platform to get ready, get people get used to the new normal, which is exhibition. Definitely everyone dream that when the exhibition gonna open, but it's depend on the government and the situation. So I would like to invite the audience. They can follow us in other platforms the next episode as well. And I would share my knowledge that I learned from this panel on the hammer and dance.
You like this concept, right?
I think it's really true, because there is a lot of rumors saying that probably we now able to dance. The next hammer gonna come soon. That's what people like start talking about. So the knowledge on this, I think the implementation, we all have to stay in this sense, live in the new normal.
Yeah, thank you. And the next is the time for the questions from the floors. No, it's not the floors, right? From the live.
Yes.
Okay. The first is how potential do you see for the hydroxychloroquine for treated COVID-19?
So now there are a lot of body of evidence reporting the evidence based on hydroxychloroquine. But so far, the result of hydroxychloroquine is not quite attractive enough to reduce the outcome. And some study really reporting that it increasing the mortality, while some study did not say that it increased mortality, but also not doing anything good as well. So clearly, there's still a lot of doubt about this therapeutic combination. Either you use hydroxychloroquine alone or combination with azithromycin, whether this could be a good choice. As a result, there's no guideline has been recommended these therapeutic agents alone or in combination as standard of care yet.
Is also ciprofloxacin, right?
Ciprofloxacin typically is the antibacterial agent.
Is it broad spectrum?
For gram-negative, which has no role for treatment of virus. Coronavirus is the virus, and ciprofloxacin will only have the role if you have the co-infection with the bacterial. Or for example, if you get sick, you admitted to the hospital, you apply some germ, some bugs in the hospital, and it's like Pseudomonas aeruginosa, you can treat it with ciprofloxacin, but otherwise there's no role for using ciprofloxacin for treatment of coronavirus.
And how about the vegan and rem?
Okay.
Oh, it's quite spelled.
Remdesivir and
remdesivir
is as I mentioned in the figure on the first slide, and this act on the RDRP mechanism, inhibit RDRP, which seem to be quite interesting because it has been studied in many countries, including China and United States. But we don't have the conclusion yet about the study result. We still have to waiting for the US study that look at the remdesivir, and they probably gonna report it in the next few months or so.
Yeah. Is there any alternative medicines for treat COVID-19?
I don't think we have formally because again, it was subjected to be studied before we claim it or before we include it in the guideline.
Yep. Okay. Is the question from the floor, not my questions.
Okay.
Okay. Next is how we can have the equipment that detect those who infect with no symptoms.
Okay, the equipment to detect people with no symptoms, so far we don't have anything to do that. But there are some researchers doing the study on the application that detect the cytokine release. And according to the report, it looked quite interesting that if you have the COVID infection, if you light up the red color, and by itself, it's really non-specific to coronavirus, but it also occurs in some virus like dengue, hemolytic fever as well. So, but it could be some help to use in addition to other mechanisms to help detect the patient who is suspected before they have the symptoms.
Okay. How about the thermal scan? Is it?
It's by itself. It can be used, but it's not 100% thing because not all the patients with coronavirus do develop fever. So fever by itself is not 100%. It doesn't have 100% sensitivity, but it can be used together with other measures to screen for coronavirus as well.
Could you please give us the suggestions for normal people like me to detect ourselves before go to the hospital?
How do you suggest you before going to the hospital?
I have a fever, cough, but I didn't go to anywhere that looks so risky.
Yeah, I think the suggestion is that you have to really, in Thailand now, most people who have coronavirus, you have the history contact to other people with coronavirus. This might not be the case in some countries that have the widespreading coronavirus already in the community. So that's why in Thailand we still rely on the definition for suspected that you have coronavirus or not. But in other countries, it may not be the same. They may use the screening strategy in some high-risk group.
So in my case, I have to monitor myself at home, right?
Yeah, if you are in doubt, you should go to see the doctor. And I think the thing that is really quite interesting will be during the rainy season because we gonna have a lot of things that confound the diagnosis of coronavirus. In tropical country, we have dengue, hemorrhagic fever, we have a lot of influenza that occur during the rainy season as well, and a lot of tropical medicine disease that also occur during rainy season. This could be very challenging, and I think we should have vaccine during the season because it will help protect influenza. And also, I suggest this to all the healthcare workers to have the vaccine as well. It's very important in this season.
Thank you so much, Dr. Anusha. We run to the end of the webinar. Kun Rose, would you please make a closing remark for us?
So I would like to thank you, Dr. Anusha and Kun Karuna. So I think this webinar is very useful for those who follow with us, and of course there would be the next session that we try to bring the knowledge to the community. So I would like to invite you all to stay tuned with us and be engaged with the digital platform that we try to bring the content and knowledge for you. So today, on behalf of Informa Markets and those two speakers, I would like to wish all of you stay safe and be respect to the social distancing to keep our hammer in the very slow level, and we can get dance in the new normal society. Thank you very much.
Thank you. สวัสดีค่ะ